Air Methods Corporation has a new flight plan for its Tulsa Life Flight air ambulances. It's opening bases in rural communities surrounding Tulsa to provide patients with better access to air ambulance service. Susan Cook is with Tulsa Life Flight.
What we intend to do is to establish 3 bases around the Tulsa area, approximately 50 miles out in all directions with our 3 aircraft, and that way we'll be closer to the community where the patients are and allow a faster response time to them as well as initiate care quicker.
One base is here at the airport at the Mid-America Industrial Park in Pryor. Moving a crew out into the rural areas doesn't take a lot of equipment or space, just a trailer for the crew to hang out in when they're not flying, and a big old H painted on the tarmac so you know where to land the helicopter. After 30 years of providing helicopters, pilots, and mechanics so that St. Francis Hospital could run Life Flight, Air Methods has taken over the operation of Tulsa Life Flight.
St. Francis Hospital looked at their options on running the air ambulance service and felt like perhaps Air Methods Corporation was better equipped to do that.
Now all the staff from the paramedics to the nurses, pilots, and mechanics will work for Air Methods, but one thing won't change. St. Francis Hospital will still be the home base of Tulsa Life Flight, even though most of the equipment and personnel will be out in the surrounding communities.
We're all going to be working for Air Methods Corporation and be closely tied to St. Francis Hospital and also St. John Medical Center. We will still continue to have the same medical director who is a physician at St. Francis and is also an associate professor at OU Medical School. And so we'll continue to have the same standard of care. We'll continue to run with the same protocols, same policies.
For more than a decade, there's been a national trend to move air ambulances away from urban hospitals and into more rural settings. It not only provides quicker access for patients, it can also be more cost-effective.
It's probably more cost-effective in that we will be closer to the patient, so we won't have that flight out to the patient and then back into the hospital.
Cook says rural airports like having air ambulances based at them, so they'll often cut a deal on the price of jet fuel needed to keep the helicopters topped off and ready to respond at a moment's notice. In Pryor, I'm Cathy Tatom, the Oklahoma News Report.